Many of us in active practice would believe that infertility rates are actually on the rise. And we also believe that the most likely reason for this is because couples are getting married at a much later stage in life in comparison to the previous generation.
There are many causes of infertility in women, ranging from problems from the ovaries, the fallopian tubes, the uterus, all the way down to the lower vaginal tract. There are many treatments available to women, ranging from surgery like keyhole surgery or laparoscopic surgery to assisted reproductive technologies, ART, simple things like fertility pills to improve ovulation. Somewhere in between, we have IUI or in-uterine insemination, whereby the sperm is processed and placed back into the womb to maximize pregnancy rates for in vitro fertilization, or some people call it test tube baby program. IVF is the preferred method for most couples because it is concise and precise and it gives the maximal results. We can observe visually the condition of the eggs, the sperm, and we can observe the maturation of the embryos in the lab under controlled conditions.
In male infertility, if the sperm parameters are affected, either the count's motility or the normality or all of the above, then an ICSI, an intracytoplasmic sperm injection with IVF would be required. In some males, you would find that there is no sperm at all in the sample. In these circumstances, we would have to do a procedure called a testicular sperm extraction or a TC, and sperm which is then identified from that extraction would be used to inject the egg.
Cryogenics play a vast major role in modern infertility treatment. We can freeze the gonads, for example sperm or eggs, in the patients who are undergoing cancer therapy, whereby their ovaries or testicles may be destroyed from the radiation or chemotherapy so that they can have children later on in life. IVF also benefits from cryogenics, whereby embryos can be frozen safely nowadays so that they can be used later or transferred later to maximize success rates.
The current trend is for young women to present themselves for egg freezing. They do this because they recognize that as they age, the egg numbers will become less and the egg quality will progressively deteriorate. Therefore, they are preserving their fertility for the future. It's important to recognize that infertility is common and there's nothing to be ashamed of. The earlier and the younger they come in, the higher the chances of success.
Seek treatment immediately if you have the issues. It's like any other disease, it can be treated. Do not feel ashamed about it, nothing to be stigmatized about it. Be hopeful, you can have treatment and start a family.